Bellaire Physical Therapy has physical therapists that specialize in several areas: orthopedics, neurology, balance and gait, amputees, pediatrics, geriatrics. So each of these areas have overlap with one another, but physical therapy as a profession has specialties, board certifications, fellowships that a clinician can become more knowledgeable in working with these areas. So for orthopedics, these are people who are specialized or focused exclusively on injuries with the musculoskeletal problems like bone. If you have osteoarthritis, if you've had a fracture, if you've had a muscle tear, rotator cuff injury, if you have lateral epicondylitis, if you have plantar fasciopathy, if you have a gastroc tear, right? People who have low back pain, headaches, neck pain. These are all examples of orthopedic type injuries. People who work in neurology focus much more on problems that develop from the neurological system that affect the muscles. You can have problems that stem from brain injury, a stroke. It could be a traumatic brain injury. Somebody had a fall and they hit their head. It could be a concussion, multiple sclerosis, Parkinson's. These are all diagnoses or injuries that could affect the brain, or spinal cord injury can affect the nerves, and as a result, they'll need physical therapy for those things. Some other examples include peripheral neuropathies, injuries that are affecting the nerves outside of the spinal cord as they go into the extremities. Balance and gait can sometimes overlap with those first two, orthopedics and neurology. So people who have fear of falling, or they actually have falling because of some sort of muscle or neurological problem. Gait, people have difficulty walking or an abnormal walking because of either orthopedic or neurological problems. Then we spoke about amputees briefly. Amputees are a very specialized area of physical therapy. Patients who have lost a body part, either an arm or a leg, or both, and they have a prosthesis, or they're getting a prosthesis, and they need to learn how to use that limb. They need to learn how to adapt their movement style. They need to learn how to get stronger and be able to function normally or as best as possible because of that injury. So that's a little bit different than just orthopedics or neurology, although that does overlap. And then we have geriatrics, people who are elderly and have, again, musculoskeletal or neurological problems, but because of their age and other diagnoses they may have, it might be a little bit more specialized. Pediatrics are usually more related to children who haven't met their milestones. Again, it could be a musculoskeletal or neurological problem. At Bellaire Physical Therapy, we have clinicians that have specialized training to address your neurological or neuromuscular condition, including concussion, brain injury, stroke, Parkinson's, multiple sclerosis. Give us a call or check us out online.